We're going to talk about something near and dear to my heart, something I've fussed with my whole career, and that is the distinction between nursing process, which is an absolute mimic of the scientific problem-solving process, and the clinical reasoning, which incorporates practical reasoning, reasoning across time about the particular through changes, transitions, and or changes, transition in the nurses or clinicians' understanding of the situation. Now, because I've studied from novice to expert, and I've studied expert nurses, I've interviewed, you know, probably 200 and observed that many expert nurses. I have to tell you, they use clinical reasoning and naturalistic, rapid decision making. So the nursing process is a great way to sort out and intellectually manage information when you are coming in as a novice and you have no experience or no lived experience of going through trajectories and trends in patients' recoveries because you're new. And so you start with thinking about, well, you need to figure out what the problem is in this situation, and you identify the problem. And then you design a plan, you design some interventions, and then you evaluate those interventions. And you go through what is very much like the snapshot reasoning of the nursing, of the scientific reasoning process, which gives you absolute judgments, yes or no decision at points in time. It's almost become a sacred process in nursing education. But notice that freeze frame snapshot reasoning isn't a motion picture. It's a slideshow. And clinical reasoning is a motion picture. It's across time. Ooh, this patient looks very different at 10 o'clock than they did at 8 o'clock. What's going on? Vital signs don't show much difference, but the patient looks quite different to me as a clinician. So I'm going to pay very close attention. I may even call the doctor and say, I can't document what's going on here yet, but this patient doesn't look good to me. I need some backup here. I know this is ambiguous. It's not quite SBAR, but come and take a look. Or maybe there's a lab test that I want ordered. Perhaps the patient has had a colonoscopy, and I want to make sure that the spleen wasn't nicked or bowel wasn't nicked. But I'm trying to catch an early warning, and I'm reasoning across time through the changes. Now, the other thing I want us to think about is that practical reasoning is very different than scientific reasoning. Even though in practical reasoning, you still use science. It is a science using practice. You cannot make a scientific experiment on the fly in your clinical practice. What you're doing is practical reasoning, which also includes internal with it is all the forsake ofs and the in order tos and the concerns about the notions of good, the qualitative distinctions of nursing practice.